So oftentimes a patient's dental needs get more advanced. They have more specific concerns, so a specialist then comes into play. As a periodontist, I've received additional training after dental school. I did my residency at the University of North Carolina, where we focused on treating gum disease, on treating recession, on treating oral pathology, on treating dental implant needs. So we specifically focus on those areas of treatment. Most people are familiar with specialists within the medical field. So if you had a heart condition, you're probably not going to see your general doctor for care. You're going to see a cardiologist. So much like the medical field, the dental field operates the same way. So as a periodontist, my focus is on treating your gum disease. If we lose teeth, we're going to then focus on replacing teeth with long-term options like dental implants. If tissues are unhealthy, if we're concerned about the health or the risk of tissues, our focus is also on oral pathology. If there's loss of gum tissue, our focus is on restoring that with soft tissue grafting. So we have a very narrow focus that allows us to do an excellent job. And so as a periodontal office, we're focused on the long-term success of our patients' care.